moment I'm doing a health and social care apprenticeship in which where you go to 5 different placements. The first one being the Staveley Centre, which is predominantly people with dementia, and then I was at the Royal Hospital, which was an orthopaedic ward, and then Kilmarsh Mental Health Clinic, DHU in A&E, and then I was at Cherry Tree House in Clown.
Hi, my name's Sonia Goodall and I'm a tutor for Derbyshire County Council, so I'm responsible for the apprenticeship right from start to finish, so supporting the learners on their learner journey. I'm responsible for doing the optional units within the diploma, so both apprentices come to me on a Monday and we go through their e-portfolio, and I also do some teaching around the optional units in which they've selected. So I'm responsible for making sure they've got the knowledge, skills and behaviours that are expected of an adult care worker. I also go out and see them in their placements as well, so making sure that they're happy, and also doing some observations as well, just to make sure that they're competent within their job role. Cora?
I'm Cora and I'm doing the health and social care apprenticeship as well. So I went to 5 placements as well. My first one was Thomas College in Bolsover. That was like a rehabilitation care home. Then my second one was Chesterfield Royal Hospital, where I worked on a ward what was frailty unit. And the next one was in DHU in A&E. And then the one after that I did Claycross Community Hospital, where they come to us after they've been to the big hospital, say if they need a care package sorting or some rehabilitation. And then my last one I did Langdale Lodge, which is a nursing home.
For me, it's the actual day-to-day care of people. So, and there's different satisfaction from different placements. So with the first one, it's helping them getting washed and dressed, and helping just making sure they're happy throughout the day. And some of them on end-of-life care, making sure they have the happiest life till the end. And then with the second placement, which was on the orthopaedic ward, it was really just helping them in their day-to-day, obviously in the rehabilitation from mainly hip fractures. And then A&E, I was mainly doing physical observations, so as they come in, making sure the blood pressure's okay. And then Kilmarsh Mental Health Clinic, it was talking to people with social anxiety, so we went on walks and just helping with that.
What I enjoyed was seeing different things in different placements. So from a care home to A&E is a big difference, because you see something that you do at day to day in a care home and you know the residents and you know what they're like, to A&E where you can get some really difficult patients and what have major injuries, stuff like that. And also we went on a day on the ambulances, which were really good because you get to go around with them and see what calls you get called to.
It's been lovely to see them growing into confident young people. When they first started, very shy, they'd never worked in social care before, but seeing the skills that they've developed from start to now has been really good. They've learned skills like taking blood pressures, moving and handling, how to deal with difficult situations, and they both now want a career within health and social care, and that's brilliant.
So my last placement I got offered a job, which was Langdale Lodge Care Home. Got offered a job there and I've taken it, and I'm going to be working with them when I finish this apprenticeship.
I want to do a TNA course as an external candidate, which I'm going to apply for later today. Yeah, I would, because I think it's been quite good because we've got different placements every 3 months. So I think maybe if you didn't like the first placement, you would have been a bit set back and maybe thought health and social care wasn't for you. Whereas with this, we've got to see every different area. So yeah.
I'd recommend it as well, because you're not just stuck in one placement, you get to see different placements and different things at each one. So like you've got something like a nursing home, and then you go to something major, say A&E, you never know what's going to come through the door, and you get a lot of experience and knowledge out of each placement.